Hi, I'm Edward McKeitry, Chief Medical Officer at Pacific Shores Health Plans. Welcome to July. As always, my interest today is to give you reliable, factually accurate, and actionable information. And there are two things that I want to talk to you about today. One of them is I have this little file that sits by my desk, and I read something and I go, that's kind of interesting, and I put it in my file. I put it in the file. And it's been sort of interesting to watch the literature come across the last month or so. Is the quality of the literature is getting to be much better, and there's some really good insights in there. The second thing I want to remind you about is the personal risk aid and map that we talked about last video. I want to bring that back up and refer you back to that because I think it's still very useful given the big explosion we've had in cases over the last little bit. The first article that made me go, was from the National Bureau of Economic Research. It's part of the Federal Reserve Bank. And it looks at the 1918 influenza and its effect on business. And one of the questions they were asking is it more important for demand to go away or be there, or is it more important for the ability to do the supply side, the workers and the supply chain? And they found three things that were kind of interesting. The first is the sales that declined during the epidemic outbreaks and peaks were more related to worker absenteeism, the inability of the workers to get to the work and do the work, than it was to the demand. The second thing was that the sales of goods and services did go down when the waves got big, regardless of what the public policy was for social distancing and staying at home in those ages. And so what that means to me is the public actually is pretty smart and informed, and if there's a lot of infection out there, they won't go places where they don't feel safe. And the third thing is that mandated closures by the policy. Remember in 1918 we had a World War going on and President Wilson was in charge, and he actually mandated closures of things. But the closures had no effect on business failures. In fact, the business failed when people could either not work or they didn't feel safe. And so I think those are lessons from 1918 that we're starting to see today that are kind of interesting. There were two other articles that came along about who gets this and where they get it. We know a lot about who gets COVID and why they get it and where they get it. And it turns out there are a couple of points there. Number one is everybody has the same susceptibility to getting this virus. It doesn't matter who you are. It's a very efficient virus in transmitting itself from one person to another. And it doesn't matter who you are and where you are, how you get it is the same. However, what happens to you once you get it, it depends upon how old you are and what your pathophysiology is like, what kind of conditions you have in your body. One of these articles said that most of the people who get this virus don't know where they got it. So that means half of the people or more who get this virus didn't have contact with anybody who had respiratory systems or had a known COVID virus exposure. So what that meant was it's probably very important for us to continue to do the hand hygiene, so wash your hands, do the physical distancing that we've been doing, and wearing face mask coverings when you go out. The second piece of information that came from these two articles was, where do people get this disease? And it turns out that about half of the people, a little over half of the people, got it from a family member or a coworker. And so it's very important, even at your family or at your workplace, to continue to wash your hands, physically distance, and wear face coverings. Third thing that made me go, this week was Dr. Fauci and his analysis of the NIH data set about who gets this virus. And over the past 4 weeks or so, we've noticed a big blow up in the number of virus cases that have been out there, but it's been a shift in demographic. What's happened is, I think, is the older people are staying home and they're aware that they could get this disease. And what's happened is the average age of the disease has actually gone down. And it's gone down by about 15 years. So the average age of the person who gets this disease is 15 years lower than it was about 4 weeks ago. Having said that, there are a number of people, the next two papers talk about how often these people die. And it turns out that if you get this disease and you're young, you have a lower case rate of death, which is known to us and has been known before, but the exact numbers have not been known. But it also turns out that if you get this and you're young, two things happen, is you still have a risk of dying, and it's fairly high. It's in one instance, it's actually about 0.25%, which is doesn't sound like a big number, but it's a massive number when you compare it to other diseases of this ilk. And the second thing is that the longer-term consequences of this disease in young people is unknown, but it's becoming more known, and it's becoming known that it actually has a long-term effect on many body systems as it goes along. So the paper from another National Bureau of Economic Research paper showed that in the United States, if you're below about 35 years old, it's called infection fatality rate, or IFR, is about 0.27%, which is a better number than it used to be from the Chinese and the Eastern and Central European literature, but it's still a massive number. The fourth thing that made me go, this week was to look at the data on what did social distancing actually do, which people call social distancing. I call it physical distancing. And it turns out that it decreased the daily spread of viruses about 20%, coming from an article published in Health Affairs yesterday. So physical distancing actually works, and if you combine that with wearing a mask and washing your hands, it's a good deal. Number 5 on my list was alcohol use and bars reopening. So if you look at the year's worth of alcohol consumption or purchasing habits by Americans, around Thanksgiving, we almost treble the amount of alcohol that we consume or sell. And if you think of people, over the holidays, they buy a lot of alcohol for the holidays. It's about 3 times what a normal week would sell in any other week of the year. Around about the 15th of March, when we locked things down in the United States, the sales of alcohol went almost as high as the Thanksgiving sales and have stayed there since that time, which does not bode well for social determinants of health in the out years that we have here. Interestingly, also number 5 on my list, in the 5th bucket here, is restaurants. And it turns out in those states where they opened or opened and then closed, it didn't matter. There was a big spike when they opened the restaurants back up in Florida, Virginia, Texas, Arizona, and California. Some of those states have closed the restaurants back, but even those states that have not closed the restaurants, people are not going to them. So the lesson from 1918 is if the people don't feel safe in the environments that they're in, they're not going to go. Doesn't matter. The next article that made me go, was a survey that was done of 50 executives who are in the vaccine producing business by a German company. And they asked these experts, when do you think a vaccine will be available to all Americans? About 22% of them said in the first quarter of 2021. About 40% said late 2021, and about another 36% said 2022 or later, and about 2% said they are not expecting a vaccine. So experts think late 2021 or 2022 or later is when the vaccine will be available, and a small minority think that there's not going to be a chance to have a vaccine. The next thing that made me go, in thinking about this was a reference to the AMA, the American Medical Association's master physician file. It's interesting, there are about 800,000 doctors who practice medicine in the United States. 42% of those doctors are over 55 years old of age. So 340,000 or so doctors are over 55. They put their life on their line every day when they go to work, and they actually need to figure out how to protect themselves. And therefore, if you can use telehealth or telemedicine, that's great. One of the things that I worry about is that we may see some of these doctors decide that the risk of practicing medicine, and nurses, the risk of practicing medicine is too great and they may exit. So we need a robust strategy, and in my last videos we've talked about this a lot. We need to educate ourselves about what this disease is and what we can do about it. Surveillance is going to be really important in our coming year or two until we get a vaccine, which is identify and test people who have symptoms, track and trace their contacts, isolate, and then treat when we have a treatment for those folks. We need to have accurate data. We need to have predictive modeling. We need to have a robust system to monitor disease in the community. Wash your hands, physical distance, continue to decontaminate your environment, wear a mask if you can. Half the folks don't know where they got this virus from. And so the chances of you getting it are as good as a quarter in your pocket, flipping it to figure out what you got. My best guess is that if you're infected, your mortality is between about 0.5% or 3%, which is a huge number. So be careful about that. And my best guess is that if you are infected and you're young, you probably are going to have some long-term consequences of the disease, but nobody really knows what those are. Businesses stay successful when they can convince the public that they're safe. And when they can't convince the public that they're safe, they will fail. We still have a number of hurts coming along in the social determinants of health frame based on the data I saw from the alcohol sales and consumption. And finally, there is a framework that you can use for your own self to figure out where you are in your physiologic, your body's risk of getting this disease and what effect it will have on you, and how you can relate to your community and your environment and the events that you go to. If this has been helpful, pass it on to a friend. Edward McEachern, CMO at Pacific Source Health Plans. Thank you.